Hello, everyone, and welcome to the latest edition of ECD Live. It is now my pleasure to turn the floor over to the Deputy Assistant Secretary for Early Childhood in the Office of Early Childhood Development, Katie Ham. Katie, the floor is yours.
Thank you so much and welcome everyone. We are excited to welcome you to the 5th ECD Live. It is great to have you with us today. We are going to be giving some updates on the American Rescue Plan, as well as the American Families Plan, and going over some new policies related to vaccines. As a reminder, this webinar series is hosted by the Office of Early Childhood Development in the Administration for Children and Families. We have some exciting updates to share this month. First, last week, the U.S. House of Representatives took a critical step in marking up a bill that includes 2 new early childhood programs. This is one of the first steps that Congress is taking to enact the President's Build Back Better agenda. The bill that's in the Education and Labor Committee reflects many of the President's priorities for childcare and preschool. First, the bill will create an entitlement program for children birth to 5 to access affordable, high-quality childcare. This means that low-income and middle-class families with a parent who is working in job training and education could get access to childcare assistance. It means that we'll be investing in quality, in wages, and ensure that no family pays more than 7% of their income for childcare expenses, and that the lowest earners receive childcare at no cost. Second, the bill creates a new universal voluntary preschool program for all 3 and 4-year-olds in a mixed delivery system. That means that preschool would be delivered through family childcare homes, childcare centers, Head Start, and schools. And as with childcare, the bill would make major quality and wage investments in preschool as well. Importantly, the bill builds on Head Start so that Head Start programs can apply to serve more children with preschool dollars. And very importantly, there is also funding set aside to increase wages for the Head Start workforce. Second, we have an update for you today on the American Rescue Plan. Dr. Ruth Friedman, who is the director of the Office of Child Care, will share more information on how states are using these critical funds to invest in the child care sector. We have now 13 states with applications that are up so child care providers can apply for financial support. And we will also hear from Elizabeth Berginski, who is the Secretary of the Early Childhood Education and Care Department in New Mexico. Elizabeth will share information on how New Mexico is using the American Rescue Plan to lay the foundation for a child care system that improves quality and increases access for children and limits childcare costs for families. She will also share how New Mexico is recruiting early childhood educators as they deal with some of the same shortages that others across the country are facing. It's back to school time for many Head Start programs this month, so we will hear from Dr. Bernardine Futrell as to why this is such an important time for the Head Start community. And last, I wanted to share some information about the steps that the Biden-Harris administration is taking to protect young children who are too young to receive the vaccine for the COVID-19 virus. The administration is requiring more adults to get the COVID-19 vaccine if they have not already done so. The early childhood community has led the way. One recent study shows that nearly 80% of early childhood educators have already gotten the vaccine. That is higher than the adult population in the US as a whole and demonstrates how this community time and again leads the way. On September 9th, the president announced that the Department of Labor's Occupational Safety and Health Administration, or OSHA, is developing a rule that will require all employers with 100 or more employees to ensure their workforce is fully vaccinated, or require any workers who remain unvaccinated to produce a negative test result on at least a weekly basis before coming to work. OSHA will issue an emergency temporary standard to implement this requirement. and it will impact organizations and businesses, again, with over 100 employees. The president also announced a requirement for Head Start grantees that all staff become vaccinated by January 2022. And Dr. Futrell will share a little bit more about that in a little while. This is an important opportunity for the early childhood community to again lead and support colleagues who are not yet vaccinated to be able to do so. We know it is the best way to protect young children who cannot yet be vaccinated. There's also, we recently hosted a child tax credit navigator training with over 200 registrants. This was on September 9th and 10th. We will share more information so people can access the recording of that navigator training, and will be able to access it and support those in their community in getting the access to that tax credit, which provides a monthly benefit if they've not already been able to do so. So at this time, it is my pleasure to introduce Dr. Bernardine Futrell, who is the director of the Office of Head Start, to talk more about back to school and the new vaccine requirement. Dr. Futrell?
Thank you very much, Katie. Hello, everyone. It's always great to be together as a community, and I'm very grateful for this opportunity to really share kind of just 4 ways that we at the Office of Head Start are thinking about this back to school season that we found ourselves in this fall as parents, as a workforce, as individuals. I think this is such a important opportunity and moment that comes around when we get ready for back to school. So the 4 ways that I just want to lift up, number 1 is health and safety are the number 1 priority for Head Start programs. And that continues to be our priority. It's the health and safety of our workforce, our children, and our families. Health and safety is also a core value of what we do at Head Start, in partnering with families to ensure access to not only medical care, but relationships with healthcare providers, and ensuring that individuals have a medical home. And in the season of back to school, families want to know that it is safe to return, and staff want to be safe in their programs. And as we walk into the new year, it calls for new safety protocols that includes masking and vaccines. And the president's announcement, I'm proud to echo it, because as we look at what it takes to get back to our in-person services, the vaccine has been proven to lead the way in ensuring that our children who are not yet eligible to be vaccinated are able to engage and be safer in their learning environments, as well as the community around them. As Katie mentioned, by January 2022, the Head Start programs, our workforce, is required to be vaccinated against the COVID-19 virus. Head Start continues to lead the way. I will tell you, as Katie mentioned, the recent research shows that an overwhelming majority of the Head Start workforce is already vaccinated. And so this process, these expanded safety protocols, really allows us to really support the workforce as we march towards our in-person services. The process that we are taking is called an interim final rule. What that means is that we will publish a rule that provides guidance on what it means to meet the requirement for being vaccinated by January 2022. All of that information will be posted. In the interim, as we develop that, the Office of Head Start is hosting webinars, and we have also updated the information on our website to provide content and to provide additional support as programs work to transition and update the safety protocols. So this means, again, for the Head Start community, by January 2022, that staff and some contractors working in Head Start programs are going to be vaccinated. And this is really going to help us keep programs open and stay safe. The number 2 point that I want to lift up is that healthy leaders lead healthy organizations. Our workforce is the top priority in this season of return. As we think about health and safety and making sure that our children and families have safe, healthy environments to return to, we have to think about our workforce. We have to address making sure that we have a strong workforce that feels supported. And as we kicked off our Labor Day webinar, that's one piece, but we're continuing to really invest in our workforce. And I'm very excited, as Katie mentioned, about the American Families Plan and that opportunity for the Head Start workforce. But there are also funds available in the American Rescue Plan to support our workforce. And I want to just encourage all of our leaders that are listening in on this line. Our workforce that showed up for the past 19 months during a pandemic, please consider ways to use those ARP funds to support your workforce, to ensure wellness, mental health supports, and even just thinking about the workload that everyone has, because we have to do this together and we have to show up together in order to be successful. Everyone is coming back into new settings, no matter how long they've been in their roles. Everything is different for everyone, and we are all transitioning. And as parents, as a workforce, and as community leaders, we have to do it together. And so as we build back towards in-person services, we want to make sure we're supporting and partnering with our workforce. And so this means, again, that using the American Rescue Plan funds to support the workforce is an allowable use of funds. But do work with your regional program office to ensure that you're doing all the proper tracking and recording of that, anything that you're using those fundings for. Number 3 is that we are in a season of first and new grace, and it's still the word of the year. And so as we think about this, and we're going to invite Cleo here to share, the Office of Head Start is expecting programs to return to in-person services by January 2022. But that's not without a ramping up towards that point. And we are in the middle of a ramping up period. And so what this means is that programs, Head Start programs, can during the season continue to deliver virtual or remote services to some of your children that are enrolled. You can make decisions based on your local health conditions and also what's best to meet the individual needs of children and families in your program. And so as we are ramping up, and you'll hear a lot about Head Start Forward and getting towards January 2022, I want to reassure you and share with you that this is still our ramping period, and it's still okay to use some of those flexibilities to really meet the needs in your community for your Head Start program. And with that, I'm going to invite Cleo to share a little bit with us about what he's doing, because we can always do more together than we could on our own. Cleo, thank you.
Thank you, Dr. Futrell, and thank you for inviting me to be a part of this. I'm Cleo Rodriguez, the Executive Director of the National Migrant and Seasonal Head Start Association. And as a leader of that organization, we could not be more pleased with the bold leadership move that the Biden administration and Dr. Futrell have taken to make sure that our children, our families, and our communities are safe through requiring these vaccinations. Because despite the fears that we know so many of our colleagues are going to have, we all know that it's the right thing to do, and we support this. And in fact, many of our migrant and seasonal Head Start programs have been in full operation since last spring due to the nature of migrant and seasonal farm worker families and the programs themselves. And so many of them were in different phases of requiring vaccination of their staff, because they recognize that that is how we're going to get to this moment of full operation. And despite the obstacles that our programs have encountered over the last several months with the different variants and the different outbreaks of COVID, they've been able to really encourage staff, and staff are really stepping up to the plate to do what they need to do in order to make sure that we can get back to this normal face-to-face operations, because we know as early childhood educators that face-to-face interaction is exactly what we need in order to be able to provide the level of services to children and families. So we're very appreciative that the administration has taken this bold move. And we as a migrant and seasonal Head Start programs are prepared to do what we can, and recognizing and working through the challenges that this initiative is going to create, because it's so indicative and so common for Head Start to be the leaders, as Katie mentioned, to be the leaders in bold initiatives, and not only to be the leaders, but also to be able to overcome these obstacles that are going to be placed in our way, because there will be obstacles, but we stand ready, we're prepared. We know we were going to have the resources. We know that it's the right thing to do, and we're really looking forward to moving forward and forging forward to get all of our staff members vaccinated. And we, with the Migrant and Seasonal Head Start Association, have taken a further step in working very, very closely with the CDC and local health departments around the country to not only make sure that our staff are vaccinated, but also to make sure that our essential workers, i.e. our farm workers that are working out in the fields every day to make sure that we have a safe and secure food source, we're working with these local communities to make sure that our farm workers are also getting vaccinated. And that's very important to us because we know that the vaccination is effective, and it is the way that we're going to get us back to a normal operating a place of operations. So, Dr. Futrell, thank you for inviting me to be here. Thank you to the administration for making that bold decision. And it certainly speaks to the leadership and the priorities of this administration. And we look forward to working with the Office of Head Start to move forward, and anything that we can do to move this forward, where we stand prepared to do that. So thank you very much, Dr. Futrell.
Thank you so much. Now we'll hear from Dr. Ruth Friedman, who is the director of the Office of Child Care, and will give an update on the American Rescue Plan. I know a lot of you are asking questions, and great questions, about vaccines. We're not going to be able to answer all of them today because we do have to go through a rulemaking process, and we want to be able to give you the best and most accurate and up-to-date information. So as soon as we have more information, we will share that with you. And the Office of Head Start will continue to share with its grantees. There is a link in the chat to the whitehouse.gov COVID plan where you can read the information that's available right now, but we'll continue to keep you posted as this policy unfolds. And I will now turn it over to Dr. Ruth Friedman. Thank you.
Thanks, Katie. Rosie, can you actually start with slide number 2? 2 and 1 got reversed. Perfect. Thank you so much. Good afternoon, everyone. I'm happy to be with you this afternoon. I thought what we could do today is talk a little bit about all the exciting information and work that is being done in the states on the ARP funding. So just to remind everyone where we are right now, normally federal funding supports a $9 billion Child Care and Development Fund program, which is largely providing vouchers for low-income working families to subsidize the cost of care. CARES and CRSA added an additional $13.5 billion into CCDF to prevent, prepare for, and respond to COVID-19 in the child care sector. And then ARPA established a new $24 billion stabilization program requiring grants to child care providers. So really a new structure than the regular CCDF program. And ARPA also provided $15 billion for CCDF supplemental funding. So all told, states receive 5 times more than their annual funding level and are managing this effort, in some cases with no additional staff, and doing really remarkable work to support child care providers and the families and children that they serve. Next slide. So the administration's goals for this COVID child care funding, first and foremost, clearly we needed to be acting quickly to stabilize the child care sector. The pandemic was particularly hard hitting on the child care sector, while child care programs in many cases stayed open so that people could continue to work. We are prioritizing increasing provider payment rates to better cover the cost of quality, to improve payment policies, again, to make it, help make the child care sector whole, increase wages and benefits for child care workforce, build the supply of child care for underserved populations, and of course, to expand access to child care assistance for more families. Next slide. You can go 2 forward, Rosie. Rosie, can you go forward 2? There we go. Great. So this is the current status of ARPA stabilization grants across the country. 15 states have their stabilization grants up and running with more than 26,000 applications already received from providers. These grants are very substantial in size, which is great news for the childcare sector and for the families being served by that sector. And many states have chosen to structure their grants so providers get extra money if they increase wages for their staff. So really great progress there. Of the remaining states, which you see on this map in the navy color, 18 have specific plans to stand up their stabilization grants either in September or October. So we're going to see a lot of progress coming soon in other states. And then even of the remaining states that don't yet have stabilization, ARPA stabilization applications projected before November, 13 are still actively awarding CRSA-funded stabilization grants, which are also very substantial in size. So for example, Kansas CRSA grants range from $5,000 to $60,000. Ohio is putting out CRSA stabilization grants and amounts ranging from $260 to $30,000. So even in those Navy states, help is already coming, or more help is on the way. Next slide. So I'm delighted that after I finish speaking, we're going to have Elizabeth Gorginski from New Mexico telling you about the amazing work that New Mexico has been doing. But just to give you an example of a few other states of where they have been moving with stabilization, Illinois has sent out approximately 2,000 awards this spring and has started sending out more awards in July and October. They're using both CRSA and ARPA funds and have sent out $270 million to date. In Arizona, the grant sizes are ranging from $10,000 to $5,000 per month for licensed centers and $2,000 to $500 a month for family child care centers and non-certified relative care. And New York just announced this morning that they've put out $153 million in stabilization grants to over 11,000 providers and having a total amount of $620 million already claimed in the coming months, which is just really great news all around. Next slide. States are also supporting providers in other ways. They're using their ARPA supplemental funds to do this. 48 lead agencies are planning for fiscal year 22 to use financial awards to help providers complete post-secondary education. At least 10 states are planning to invest in or expand their scholarships and wage supplements through the Teach and Wages programs. And at least states have invested in or expanded shared service models to support childcare businesses. All really important policies moving forward for supporting providers. There are also states choosing to do things like funding on enrollment instead of attendance, which we all know is really important for providers, but something that states were a little reluctant to do before COVID. We're hoping this momentum continues on. Next slide. Some states are also using their supplemental funds to increase their payment rates to providers. Here we have some of these examples. We don't have all of the state information in, and so we're hopeful there will be more. But despite the fact that some states have been concerned about the one-time aspect of funds, we do have states boldly moving forward to do a better job supporting providers with their reimbursement rates. So for example, Arizona has increased their rates from the 25th to 75th percentile to infants and toddlers. West Virginia has increased preschool family child care rates from the 55th percentile to the 90th percentile. So good news across these states. And we have also been told that Pennsylvania and New Jersey will also be raising their base subsidy rates this fall. Next slide. So states are also using their ARPA supplemental to expand assistance to more families. 21 states have increased income eligibility in order to reach more families in need of childcare assistance. And many other states, while not increasing their income eligibility, they have been able to expand their reach within their eligibility. So we have some states who are able to clear their waiting lists, and other states who are simply aggressively moving to serve more families with this funding. And from the small number of states that we have reported so far, we expect that more than 300,000 additional children will have access to child care assistance in this coming year because of the ARPA supplemental. And again, this is quite a major underestimate because we do not have this data yet from most states. Starting in the beginning of the year, we will start collecting more administrative data from states and be able to have a much clearer and up-to-date picture of the number of providers and families who are being helped by ARPA funds. Next slide. And then finally, I do just want to direct folks to our website. OCC continues to work with our technical assistance centers to deliver TA to lead agencies who are administering these funds. So resources are regularly being added. There are FAQs up, as well as different charts and practical guides to help folks with implementation questions. And the Office of Child Care just kicked off, I believe, last week, our first office hours and communications, which will be ongoing. These are providing opportunities for CCDF lead agency personnel who are focused on ARPA implementation to discuss any questions or needs or resources with TA staff. We have representatives from OCC's Planning, Data, and Policy Division attending those office hours in order to be able to answer questions. It was really heavily attended in its opening session, and we hope that states continue to take advantage of this resource. I'm going to drop a couple links into the chat so that you guys can see where to go for these, but really do recommend that you keep an eye on our website for continued updates to those resources. With that, I am delighted to introduce Elizabeth Gorginski. She's the Cabinet Secretary for New Mexico's Early Childhood Education and Care Department. The Secretary is doing really innovative and wonderful things in New Mexico, and we are so pleased that she agreed to come today for ECD Live to discuss New Mexico's child care plans. And with that, I'm going to turn it over to you, Elizabeth.
Thank you, Ruth. I appreciate the invitation and the opportunity to share the work happening here in New Mexico. Rosie, you can go to the next slide. For those of you who have not had the opportunity to visit our incredible state of New Mexico, the land of enchantment, I encourage you to visit. We are one of the most culturally vibrant and linguistically diverse states. As you can see, we have 23 sovereign nations, pueblos, tribes, and nations, and we are home to the oldest continuously inhabited communities in the United States. We have the largest proportion of Hispanic people in the nation, and you can see here that we have a small population, but a very large land mass, making our state highly rural and remote, and creating different challenges for us. And we are hopeful that we will soon no longer be ranked highest in poverty and lowest in child well-being, given the dramatic changes the New Mexico State Legislature and Governor Lujan Grisham have made in the last 2 years. In 2019, the legislature passed and the governor signed into law and the Early Childhood Education and Care Department Act. We became the 4th state in the nation with a cabinet level early childhood department, and this consolidated all early childhood programs and services prenatal to 5 to really support that alignment and integration. As you'll note here, our official department launch date was July 1, 2020, which of course happened in the midst of the global pandemic. And I'm happy to say that because of that coordination and collaboration that was in place, we were able to successfully support our early childhood community across home visiting, childcare, pre-K, family nutrition very well. And I just want to give big kudos to our staff who made this possible, having to move to a new department and stand up a department in the midst of all of these changes that you all are very well aware of who are on this call today. So the commitment that this department has made to the people of New Mexico is to create a cohesive, equitable, and responsive prenatal to 5 early childhood system. Rosie, if you'll move forward the slide. A system that actually supports families, strengthens communities, and enhances child health, development, education, and well-being. This commitment is so critical to the success and the promise of this new department. And we knew that it would be important for us to launch strong. And I want to thank the Hunt Institute for their partnership in helping me bring together a transition committee in the very early days, again, in the midst of the pandemic. We met virtually. The Lieutenant Governor, Howie Morales, our Secretary of State, Maggie Toulouse Oliver, co-chaired a committee of cabinet level secretaries, the governor's office, senators, and representatives from both the Republican and Democratic Party of New Mexico. And we also had the expertise of 2 national early childhood experts, Bibi Otero and Harriet Dichter. And through this process, if you'll go to the next slide, thank you, Rosie, we culled out 5 strategic priorities that this department had to focus on if we were going to achieve the commitment that we had established for the people of New Mexico. And the first was to grow investments. The first year after the department was formed, the governor put forward an early childhood trust fund. That trust fund sat with $300 million to grow. I'm happy to report that that trust fund is growing rapidly, much faster than we thought. That trust fund will disperse to our department annually as a proportion, 5% of the corpus, or 30 million, whichever is greater. So that's exciting. And we knew that the first thing when we had new investments, we have to advance a diverse, well-compensated, and credentialed workforce. We can't increase quality and access if we don't have a wonderful workforce that's well compensated to do that. And we needed to achieve equity because for too long, there are too many communities across New Mexico that have not had voice, have not had part of the decision-making. This includes our relationship with our tribal sovereign nations, as well as many other communities that have not been part of the decision-making and the setting of the priorities for the state. So that is another key part of our priorities. And then enhancing authentic collaboration, making sure that we are really working with communities, working with families to bring their expertise and their understanding of the importance and the critical nature of these first 5 years of life, that everybody understands this rapid period of development and what they can do to contribute to it. So part of and if you go to the next slide, part of the act that created our department told us that we needed to create a 4-year finance plan. And it was daunting, but we thought this is exactly right. And it's so helpful having this with the American Recovery Plan, because we're really thinking systemically about building an early childhood system. My favorite quote is, every system is perfectly designed to get the results that it gets. Here in New Mexico, you saw we're 50th in child well-being, we're 49th in child poverty. Our system is producing those results. So how do we address the broken childcare market? How do we look at this cross-sector approach that includes education, family support, maternal health, and health, all the opportunities that are embedded in the American Rescue Plan? And really our job as state leaders is to take that forward. So the first thing we knew we needed to do with this being part of our department was that we needed to do the cost estimation model. And we're really pleased, if you go to the next slide, that we are the first state in the nation to seek and receive ACF pre-approval to conduct the cost estimation study to inform our rate setting. This was a powerful exercise in engaging stakeholders across the state, really helping us all understand, how is our system designed? What are the licensing requirements? What are the quality rating improvement system requirements? And so we're so happy that on July 1st, we were able to establish new rates and increased rates for all providers in every setting at every quality level. And it was so important that that happened on the first anniversary of our department, but also, as a key part of this 4-year finance plan, because this is a beginning. First, when you do the cost estimation model, If you look at the next slide, New Mexico had very good rates under the market rate. I think we were at 75th or 80th percentile of the market rate. But you can see that we were still underfunding centers 21%, family childcare 38%, and group homes 27%. We know right now we are funding our family childcare and group homes exactly what it costs for them to deliver the care to children at all those different ages and quality. Centers, we have more room. We need to continue to look at this, but it was an exciting process and a way that we were able to really use the 4-year finance plan, the cost estimation model, to advance better outcomes. And part of it, and I'll talk a little bit when we talk about the workforce, part of what we did in that rate setting, of course, the biggest cost driver is our personnel and what we're paying our workforce. I'll talk about that in just a minute, but I want to talk next about childcare rates. So we knew we were going to increase the rates, and we knew that this was going to result, if you go to the next slide, that more families were not going to be able to afford what we know it costs. And so the first thing we wanted to do, this just gives you a real quick snapshot of how much funding New Mexico received from the American Recovery Plan. Go to the next slide. I want to just point out for you to show what it costs in New Mexico, right? A family paying for 2 children, this is just some estimates, maybe a preschooler and an infant and toddler, is paying about $2,000 a month for high quality childcare. If that family is only making $55,000 a year, nearly half of their income is going to childcare alone. So that family under our old eligibility, which was 200% federal poverty level, they would not qualify for any assistance. So they're paying half of their income, obviously not being able to save for their child any emergencies, save for any future college or educational expenses. So a really huge impact. So we, if you look at the next slide, we expanded eligibility. We used the American Recovery Plan to say, we have to bring more families in to receiving assistance. So you can see we moved from 200% of federal poverty level to 350% with a phase out at 400%. No parent co-payments at 200% FPL and below. And we are looking hard at our co-payment schedule right now to achieve what we've heard the Biden-Harris administration is talking about, 7%. We don't want families paying more than 7% of their out-of-pocket expenses for childcare. So that work is underway, and we'll be using the American Recovery Plan to help us support that. But really, it's about making sure that more families have access to quality care and to get that assistance, and that our provider community can actually be receiving the higher rates for families who are on our child care assistance. I think what you'll all know is what we all know is that the market, parents pay what they can afford, and that's what providers are often charging them. So those are some of the challenges that we're working through, and we're so grateful to have the American Rescue Plan to help us with this effort. The Stabilization Funds. We are one of those states, and we're so happy that we just released our application September 1st. We have almost 250 applicants. We want to see a lot more than that. We're starting our outreach this week with personal phone calls, make sure that everybody has seen the communications. But we did really look at this, and I want to thank our colleagues in Connecticut who we did build some of our strategy and our stabilization funding formula off of their model. License capacity, looking at the part-time versus full-time, waiting for quality, waiting extra for infants and toddlers, and then with the equity perspective using the Social Vulnerability Index, which is looking at a number of factors that give higher amounts to programs located in more vulnerable communities across New Mexico. Go to the next slide. So in workforce development, some of these funds we've actually been able to use through our ongoing state budget general fund. Some of it is part of CURSA, and some of it will be part of ARPA. But we have improved compensation. During the last year, we issued differential payments to providers for every contract they had and required them to spend 30% of that on their workforce. Really innovative ways that people did that, and we're happy to report that all of our providers who receive that funding were able to meet that 30% requirement. We use the cost estimation model. So here you see, we were building the model starting last September up till now. Our minimum wage in the state will go to $12.10 in 2022, or 2023. So we built the base on that and then ratcheted up across. Clearly, once we saw the recovery and everybody's paying 15, we had a great meeting with the Legislative Finance Committee staff, committee a couple weeks ago. And it was wonderful to hear legislators saying, we need to pay more if we want people to do these jobs. So we said we have a model now. We can model for 15, for 18, whatever we want to say is the base pay that anybody working in early childhood should make. And then we can see what that fiscal impact will be for the state. We expanded wage supplements and bilingual bonuses and scholarship programs. And we're working with our early childhood community to really market. This is a field that you want to become part of. You can start a career, you can enter into a program and you can get a scholarship right away and start your career development. You can apply for a wage supplement if you earn less than $16 an hour. So these are all opportunities that we have been doing through the recovery efforts, statewide job fairs, which has been challenging given people's concerns about coming back into the industry, but we see success and we see a really strong partnership with our workforce development partners, as well as our early childhood provider community, really thinking innovatively and creatively together about how to support the workforce, because we do see shortages, as all of you do across the state in all of our programs. I think that's all I have. If you want more information, I would love to talk more about it. And again, I just really want to thank the Biden-Harris administration, this team here, for helping us think creatively about how to use these dollars to build strong, cohesive, equitable early childhood systems for families and children.
Thank you so much, Elizabeth. It's just so great to hear how you all are working in New Mexico to use the ARP funding to build such an impressive childcare system and work through some of these chronic issues. So we really appreciate you sharing today. A number of people have asked for your PowerPoint, and we will be sharing that in the follow-up email that comes after the presentation today. Earlier this month, the Administration for Children and Families was really honored to host an event with a number of childcare and early educators across the country to talk about what early childhood investment is needed and the importance of investing across different early childhood settings. As I've said before, the administration's Build Back Better agenda includes childcare and preschool in a mixed delivery setting. That means family childcare, childcare centers, Head Start, preschool, all providing childcare and preschool service delivery together. So we were really excited to bring together folks who represented a lot of different early childhood settings to talk about what quality can look like across settings. I want to just share a really inspiring clip from one of our participants who is the last year's Teacher of the Year and a preschool teacher and coach from Kansas. We're going to put the link to the event in the chat. It's definitely worth an hour of your time. We really encourage you to share it on social media. If you can just take a minute right now and share it on Facebook or Twitter. And I will let Tabitha take us away.
Yeah, sure. You know, as been mentioned before by several of my colleagues on this call, is that research does tell us that brains are developing most rapidly in those pivotal years from 0 to 5. So we know that it's critical that we reach children. And we also know that just like in schooling from K through 12, we reach children and we reach families differently based on their needs. So what we have to do is sort of think about our funding in a different way. Like it needs to go to families in a way that works for their family, to schools in a way that works for their family, or to any early childhood education setting. And that's because we know that kids who have access to an early education program thrive later in school. kids who have access, again, to quality early childhood programs that we fully fund and that have educators who are trained and are coached and are doing the best that they can with the resources that they have. We know these kids are going to be less likely to repeat a grade later on, to require special education, to need child welfare services, to engage in activities that might be maladaptive later in life, and eventually are going to make higher incomes than those of their peers that didn't attend a high quality early childhood education program, which really sets their family on a track for success long term and generational success. But what we have to realize is that there's an alarming disparity in the pay between early childhood educators from state to state and program to program. And so that's something that this Build Back Better is going to help us address and let us be more, I don't know, just more cohesive as a country worldwide. Like, so often we think about, what do I need to do for my students or my kids in my home? But that no longer can be how we think about the kids in this country. We have to think about them as a whole. They are our kids in our community, in our world, and we want all of them to have the same access, the same opportunity to access quality early childhood education. And did you know that most communities don't offer any free early childhood education experience? You know, I speak specifically about 3 and 4-year-olds a lot when I speak, because that's the age group, right, that I work with the most. And there are 5 million 4-year-olds in the United States, and only 1.5 million of those 4-year-olds get a free pre-K program. So that means that we have 3.5 million students and their families that are potentially underserved. And so often we talk about kindergarten readiness. You know, it's a term that we hear frequently used in legislative sessions and in the news and in our own conversations in our communities. And kindergarten teachers do report that learners are more socially and academically ready for kindergarten when they have an early childhood program or experience. And that is one important thing that we can do for kids in their formative years. And I don't want to discount that with the next thing that I'm going to say. But families cite a lack of early childhood experience that works for their family as a major hurdle to their success right now. Okay, so not in kindergarten or not later. Families are focused on what they need to do to survive this pandemic and their own job loss, their own issues with their own income. And so we need to do something right now, not only looking forward, but to provide them for what their immediate needs are. And when we look at the needs in our country, it's important to note that quality early childhood programming can help address all of the outcomes that our country hopes to improve. Research backs it up. Everyone on this call backs it up. And we can do that for families when we work together.
Thank you so much. That concludes our session for today. Thanks everyone so much for joining us, and have a great rest of your day.